Barrington, I'm going to show or demonstrate a IV medication. So I'm going to look at my doctor's orders. The doctor wants 500 milligrams given over an hour of vancomycin. We're going to draw up, my vial of vancomycin is 200 milligrams per milliliter, so I'm going to need 2.5 milliliters of that. And we're going to put it in a 50 milliliter bag. So doing our calculation, that would be 8.3 drops a minute and about 1 drop every 8 seconds. Vancomycin is an antibiotic. Some common side effects are nausea, vomiting, superinfection. The dosage is usually weight-based. In this case, though, the doctor wants 500 milligrams, so that's what we're going to give. Our patient is allergic to aspirin only, so he's safe for the vancomycin. And the lab values that we're looking at is the high white blood cell count, which is why our doctor ordered vancomycin for infection. So what I'm going to do first is draw up 6 milliliters of normal saline as a flush for our line that's already in place. Cleanse the top of my vial. Before doing this, I would have washed my hands. Sorry. So my hands are clean while drawing up our lid. And we have 6 cc's of a flush now. I'm going to recap this until I need it. Okay, and now I'm going to drop the vancomycin. 2.5 milliliters for our 500 milligrams. Cleanse the top of this vial. .5 cc's of air. Have 2.5 cc's of vancomycin. I'm going to go ahead and actually cleanse the port on this and go ahead and inject it directly into my 50 cc bag to make our concentration. And then I'm going to discard this needle directly in the sharps container. Okay, at this point I'm going to spike my bag with the tubing. And this is sterile because it's still capped. Close the roller clamp. And squeeze the drip chamber. Okay, now I'm going to come over to my patient's room because I am all prepared to give them this medication. I'm going to prime the line to get all the bubbles out. Okay, and now we come in, we're going to tell the patient why we're giving the medication because we believe you have an infection. This is going to help. There's an antibiotic in here. I'm going to attach the label with my medication and my initials and the concentration on the bag. And I'm going to go ahead and flush his existing INT. So I'm not going to need this needle. This is a needleless system. Okay, and I'm going to aspirate and push pause and put in 3 cc's of my fluid. So this line is patent. Now I'm going to cleanse this line. And apply it directly to here. Now that that's in place, I am going to adjusting my roller clamp adjust to watch for 1 drop every 7-8 seconds. And then when I make sure that that is flowing at the right rate, I'm going to leave it in place and watch it for a few minutes, make sure it's running, everything's good, and the patient's not bending their arm or anything to occlude it. Then when I come back and it's done, I'm going to disconnect the line, close the roller clamp to stop the flow. I'm going to apply some sort of clamp to keep this in sterile so they can use it for the next set of antibiotics if it's within 24 hours. And I'm going to flush this line once more to make sure that it is still patent. I'm going to aspirate, push, aspirate, push. Using positive pressure, I'm going to clamp this, and if this were a PICC line or any kind of internal device, I would use heparin flush to finish. Now that that's all done, to make sure my patient's comfortable, I'm going to go document my name, initials, what medication was given, document on the MAR that I gave it, per the physician's orders, the concentration I used, and the milliliters that were actually given to the patient, and the date and time, and how the patient tolerated.